Very sad news about these two NHS nurses, Katie, and also our death toll that's gone through 3,000 today.
Yeah, again, we are seeing these significant increases in the number of deaths day on day, but we should say that we are in the place where many of the government scientific advisors thought we would be at this stage, according to the models that they have predicted. Significant increases, though. Before we get into the UK numbers, we should just say, if you are doing the maths at home, if you add up England, Wales, Northern Ireland and Scotland, you might notice that actually there's a discrepancy in the number of total deaths in the UK. That's because the UK total that we are given is separate from the Department of Health. Now, their figure, we believe, according to the number crunchers that we've got working on this, actually takes the figure for Northern Ireland and Scotland from the day before. So actually, that's why you'll see that discrepancy. But it does give us a really good insight into exactly what's happening number-wise. So let's just look at the UK figures now to start with, shall we? So in the UK, we know that the total number of deaths now stands at 3,605. That is an increase on the previous day of 684, a 23% increase. Now, the one that many of the scientific advisors are paying close attention to, though, is the number of confirmed cases. That now is up to 38,168, an increase of 4,450. What the scientific advisors want to see there is if that is starting to flatten out. So it'll be interesting to see what is said at the number 10 press briefing later on and whether or not they were happy with that figure. Now, if we take the individual figures for the different countries, having a look at England now, we know that the total number of deaths in England has now increased to 3,302, an increase of 604, higher than yesterday, but in the range of which the scientific advisors had predicted. Taking the figures for Scotland, we know that there has been an increase of 46 deaths in Scotland, taking the total there to 172. If we compare that to what's happening in Wales, we know now that the Wales total stands at 172. That is an increase of 24. And taking finally the figures for Northern Ireland, the total deaths in Northern Ireland now stands at 48, an increase of 12, which is actually double of the number that we had on the day before. I think what's interesting actually as well is if you break down the figures for England, actually the growth rate in London appears to be slowing. The number of deaths in London is at 161, we found out this lunchtime, but the rest of the UK appears to be catching up. So we know that the numbers are accelerating in the Midlands. They now stand at 150 coming out of the Midlands, and in the Northwest it's also accelerating. 88 deaths came from the Northwest. Sadly as well, we have to confirm this afternoon, we've heard the confirmation of another death of an NHS nurse. Aimee ORourke was 38 years old. She died from COVID-19. She worked at the Queen Elizabeth, the Queen Mother Hospital in Margate in Kent. It was the same hospital where she had been being treated for the coronavirus. Social media posts are paying tribute to her. We know there's one from her daughter where she describes her mother as being an angel, saying the family is trying their very best at the moment to stay strong. And on a GoFundMe page that's been set up in her name, it talks about how Aimee gave her life to make sure that other people survived the virus. And sadly, it isn't the only case of a nurse that we've had today who has died from the coronavirus. We also had confirmation from the husband of Areema, Nasreen, who worked for Walsall Manor Hospital. She was 36 years old and a mum of 3. She died last night. She'd been in intensive care and on a ventilator for a couple of weeks. She was diagnosed with COVID-19 a couple of weeks ago and being treated at the same hospital where she worked. Certainly, I think, again, these two deaths will really raise questions about PPE and whether or not those working on the front line have the correct personal protective equipment that they need. Very sad news, though, confirmation of two deaths of NHS nurses.
OK, Katie, thank you. And just to bring you a bit more on that, we've had a statement from the hospital where the second of those two nurses that we announced the deaths of today was working. This was the 39-year-old nurse, Aimee ORourke. She was a nurse from the Queen Elizabeth, the Queen Mother Hospital in Margate. She died after testing positive for COVID-19. So says the hospital. She died in the hospital's critical care unit On Thursday, the 2nd of April, she was 39. She joined the acute medical unit as a newly qualified nurse in 2017, and the ward manager said that the whole team was devastated by her death. She said she was such a kind and caring nurse, and she had a really special relationship with her patients and her colleagues. Nursing was something she'd always wanted to do, although she came to it relatively late after raising her girls. She took some time out to care for her mum after she was diagnosed with cancer, and she was determined to return and to make her mum proud. Aimee was a really valuable part of our work family and would always offer to help if she could. She was really growing and developing in her skills and confidence, and I know that she would have gone on to have a great career. That statement coming to us now from the Hospital of Queen Elizabeth, the Queen Mother in Margate, where the nurse Aimee ORourke has lost her life at the age of 39.